Alrighty. So hello, everybody. We are going to start about talking about communication with industry professionals. So this is our animal science class. We have been talking about reproduction needs in animals. We have been going through the different types of castrations, and we have been talking just about what cellular parts of the cell look like for the different animal cells. So as a class today, I want us to try to figure out how do we communicate to get a schedule for the vet to come out and get our animal surgically castrated. So in terms of animal production, in the chat you can unmute yourself and talk. Who would you communicate with? When would you communicate with others? And how do we communicate with these people? You can either put it in the chat box down below, or you can go ahead and unmute yourself and talk. So I see Emily would communicate with her veterinarian. Kai would also communicate with a vet. Bethany communicated with a vet a couple of weeks before the surgery. So thank you for giving a time frame of when you would want to communicate that, Bethany. Derek would communicate with a vet and schedule the appointment. I would call our vet. So thank you, Weston, for answering the second part of how would you communicate. So you would call them. Emily would communicate with them at least 1 month prior to the appointment. It could be a little bit difficult to get on a vet schedule. Kenzie would call or email the vet they would want to come out and have the castration done on. Awesome. Take another second if you're just finishing up typing something, and then we're going to move on from this. Katie would call the vet to set up an appointment. Joseph would talk to the vet over the phone. Vita would see a vet when your animal needs to be castrated, probably once the animal hits its sexual maturity. So like I discussed, our goals for today are we're going to describe the rules of effective communication between a client and patient. We're going to empathize with our patient to try to ease some of their nerves with the castration process. And we're going to practice communication between the client and veterinarian. Communication methods, a few of you mentioned email, phone calls was another one, text message, and in person. Those are some different ways we can go ahead and communicate. There's going to be a poll that's going to come up on your screen in here in a second, and you're going to tell me which one you're most likely to use when you are calling your vet. All right, and that poll should be coming out to you right now. Phone so far is winning 9 votes on the phone, 11, 14. One person would do it in person. Has anyone had to call someone to have their animal castrated before? Vita was shaking her head, yes. I know you've called me before, and then Miss Horsebach came out to castrate your goats last year. So talk about communication. There's a bunch of things we want to keep in mind. So we want to repeat the question back to the client, make sure that we understand. So if they say they want to have their male horse castrated, we want to respond back, you can get your male horse castrated on this date. That way we have a record of what's going on. We want to use medical terms and normal terms to help them understand. So I can say that in castration, we're going to go ahead and open the scrotum and remove the testicle. That's fine, but I don't need to get into the nitty-gritty of smaller parts of the incision size or anything along those lines. I want to make sure that I'm helping reassure the client not to scare them away. I want to ask them questions about their pets, about their animal to help build a relationship with them, but also get to know their animal a little bit better. And describe the procedure using larger concepts. Again, I don't need to go into small step-by-step of what I'm going to do. I'm going to sanitize my hands. I'm going to sanitize the incision site. I'm going to make an incision across the scrotum. Those smaller details will only add fear to the client and not calm them down. Is there any other tips that you would say separate communication or that you've communicated with a vet before. You can either unmute yourself or you can type if you would like. Alrighty, we're going to move on then. So in the chat box, or you can again unmute yourself and talk. What are some risks associated with castration in the animal? How do you feel these risks how would you tell these risks to a client, and how would you select which castration method to use? So we have some different answers coming in here. Weston, an animal can get tetanus from banding. I would give them a vaccine to prevent that. Bethany said making a wrong cut or cutting something wrong in the procedure would be a risk. Kaylee said for some methods, there could be a chance of missing a testicle. Katie Ann said the infection is a big risk, but you can make sure to use antibiotics to prevent that. Vita mentioned that animals in surgical castration need to be put under, which can make the risk with any surgery like infection and blood loss. Derek would say that they could be NBE errors during the surgery. Kaya, the animal can get infected. Kenzie said she would calmly tell them so they are not scared or worried. I would give them different options of castration. That's a good point, Kenzie. So if we can weigh our options there and give all the resources out and let our client make the decision. Ari said a risk of infection. Abby said you can miss a testicle or get it infected. Emily said infection. I would tell them that anyway could cause infection, not just surgical. That's a really good point to bring up. Some people are afraid of surgical castration just because it's a surgery, but infection can happen regardless. I would probably use a clamp or a band method of castration. Give you another minute or so just to put final thoughts. I hear a few more people typing. All right. We're going to look at this from the client and the vet's POV. So the point of view from the client, we have what questions might the client have to ask? They are going to have a ton of questions, maybe especially if this is their first animal. They're not as familiar with the animal sciences as some of you are. And how might the client feel about this procedure? If we can unmute one or two people and answer one of these questions, that would be great.
They might be wondering like the cost.
Yeah, cost is definitely a big question. I see it all the time on different Facebook groups. Where can I get the cheapest neutering done for my animal? Good. Cost might be a question they have. Any other questions?
Maybe like if anesthesia will be used at all, and if they'll be put to sleep or not.
Okay, so if anesthesia would be used and if their animal would be put to sleep. So that's the sedation versus the anesthesia question. Yes. Bethany asked how long the surgery would last. Kenzie said, will the animal be hurt? Will they be scared or worried? How long is recovery? If there's any recovery. There was a question that popped up that I also missed. Let me go back to that. The doctor's opinions on what the method they would think would be best. And then how might the client feel about talking about this procedure taking place? So these are really great questions that are coming in. Bethany added, how much medicine does the animal need afterwards? What's that dosage? What has happened in past procedures? Has the vet made a mistake before? Is there a successful method? Yep, these are all really great questions that are coming in that might be on the client's mind as we are going through the discussion about this procedure. I'm going to launch a poll here in a second, and it's going to just ask you, if you were the client, how would you feel towards the procedure being done? And again, we're talking about surgical castration of our horse. So that is a surgical procedure. A lot of votes right now on worried. Well, votes for worried. So that is everybody. Oh, one person said relaxed. Yes, I had my horse castrated, and I really wasn't afraid till he did get an infection afterwards. 2 people said relaxed. Okay. Looking on the flip side of our vet's point of view, how would you respond to these questions of the clients? We don't have to answer every single question that we were asked, but what are maybe the tone of voice you want to use when you're answering these questions? How do you make the client feel calmer? And how do you advise a client about a potential risk? Again, if you can unmute yourself and answer and or go into that chat box. Calm and relaxed voice. Calm voice, sound confident and knowledgeable. Knowledgeable is a big thing. If you are stumbling around and not making really much sense, it's going to be hard to trust you as a vet. Calm voice, be positive. Know all the information well going into the conversation, sound confident and positive. The vet talking with confidence. Tell the client that the less they worry, the easier it will be for them, and it will not stress the animal as much. That's a good relationship there, Vita. The more stress that the owner has going into the procedure, the more stress that the animal will have going into that procedure as well. Give your input and past positive experiences. Yeah, you're giving like a success rate of, I do 4 castrations a week, and overall they go really well. I have very limited infections, and the animal bounces right back. Be ready to answer questions they may have. Give questions you heard and then answer them. All right, we're going to move on to the last part of what we're doing. So we're going to do a little role play here. You guys had a lot of questions here in the chat of what you would ask your vet. We are going to go ahead and randomly, you're going to be selected to answer the question. If you don't know the correct answer, that's okay, but at least try to use a calm voice and practice most communication methods that we had. So I will be your client, and you all are the vet professionals in the room. So we are going to start with the question of what has happened in past procedures, and our lucky person to go, and I'm going to pull up the whole list here. Kenzie, you are our vet expert. How has past procedures gone? If you can unmute yourself, please.
Past procedures have gone is we just missed a testicle and nothing else happened.
Thank you. Our next question. How long is recovery time? And I'm asking that question to Kaya.
In the past, recovery time has been like 2 to 3 weeks.
Thank you. Is surgical castration a successful method for horses? And that question is going to Savannah.
Yes, it is a successful procedure for horses.
Ari, how do you know if there is any infection?
There can be blood that is drawn within the surgery.
Yeah, so drawing blood in surgery. There goes our bell. And we'll do one more question. Emily, have you ever made a mistake before?
There has been like a little mistake, but it didn't result in anything really serious.
Awesome, thank you. So for those that did not get to ask questions, how did you feel about their responses? Were they making you feel that confident and that calm like you were looking for? Any feedback for our vets? Emily says for the most part. Yeah, I would say overall really good. The questions were on the spot, which was be how a client would communicate with you. You definitely draw in some of you knew the answers to the questions. But yes, I would agree, Derek, a little bit more confident and ready to answer a question that might come your way. So to recap, communication between a vet and client helps build these relationships. Communication can help de-escalate the anxiety of a client, and communication allows for smooth procedures to occur within the office. Is there any questions on how we can communicate with our vet and our client to build that relationship? All righty. Well, thank you guys. You are good to log off.